Coffee with a Chair was recorded before a live studio audience.
Welcome to Coffee with the Chair. I'm Teresa Aronson from the St. Lucie County Chamber of Commerce. It is our pleasure, our honor to facilitate this event every single month. I think we still do it on the second Friday, and if I'm correct, today might be the second Friday. And I do it, of course, with the Board of County Commission Chair, and that is none other than my good friend Kathy Townsend, who's here with us. She brought a guest, and we will introduce him, very, very shortly. And I just want to say thank you to Sandy, Art Allen, Travis Leonard, all of our friends at A&G Pools for sponsoring our show, and Mike, who brings us coffee and Danish from Steamworks on US 1 in Port St. Lucie every single month. So thank you to all of them. We're going to go ahead and get started because you did bring a guest.
I did. So every single time I'm out in the community, and a lot of times at some of the meetings, there are people that have needs, and we have services that people aren't aware of. So I'm trying to do a better job this year at educating. So we have a department called Community Services, and they provide multiple things for housing. And then we also have Jose, who is over our veterans. And so he's going to talk a little bit about the veterans and the services that are provided for veterans, because people don't realize there is a bus every day that comes to the front of our building that takes them to the hospital and their appointments, among other services that we offer for them.
And there are hospitals in West Palm Beach, right? And it takes them all the way down.
Yes. And so he's going to talk about the services and some statistics. And then he's also, I think, going to share some of the other services that Community Services offers. Did Diane prep you on all this, Jose? Do you know all this information? If not, we'll go grab her.
I know. We'll mic her up and bring her up. But welcome to the show, Jose.
Well, thank you for having me. Thank you, Commissioner and the county, for being so supportive of the veterans. It is my honor. I'm a veteran myself. I retired from the U.S. Navy after 31 years as a warrant officer, and I find it a privilege to serve our veteran community once again. So with that said, we'll get into some of the things that we do. We'll start with the transportation department, which the commissioner has already told us about. So we actually take our veterans to their appointments at the VA Medical Center in West Palm Beach, Monday through Friday. We also have transportation to the local C-Box. Those are community-based clinics here in the area. And we also have a smaller program that we call Vet Assist, for veterans who have medical appointments non-VA related. Like, for instance, we had a veteran who was going through chemo and radiation and didn't have transportation. So one of my drivers, I have 8 part-time drivers who are also veterans, would pick him up at home, take him to his radiation treatment, and then bring him home and make sure that he was okay. Because most of the times when you go through those treatments, you're kind of worn out.
Yes.
So we have that. And all the veterans have to do is call our office, and with some anticipation, a week in advance, says, hey, I got an appointment, this is what we got to do, and we'll take care of them that way. So it's a phenomenal program. It doesn't cost anything, and we do it in partnership with United Veterans America. They actually get the buses for us, and we go in agreement. The county pays for the drivers, for maintaining them, for gassing them, and we take care of our veterans that way. But we have a lot of other programs.
So let me stop you right there.
Sure.
We also, in our transit department, have other services and buses for the general public that need dialysis and stuff. We have door-to-door service for them as well.
Yeah.
Have we had them on the show before, Kathy or somebody?
We haven't had transportation on in a very long
because
time.
Our transportation department is really developing and growing, and they're doing a lot of really good things. So maybe we need to do that in the future, one of those shows. So I just wanted to touch on the transportation. We have it for the general public as well, but this is specific to the veterans, and they have their own buses and vans.
Perfect, yeah, because we have the ART buses, which is transportation. I did have a question about the veterans though. So when they call you and they say, okay, I need your service and I'm a veteran, what do they do to prove to you that they're a veteran? What is the process? Is there a vetting process? How does that work?
There is, and most of these veterans have been our clients for other services. But every veteran gets a DD-214. It's a certificate of eligibility when you get out of the service, and that's all we need to verify they're a veteran. We also get on the VA computers and we could verify that way. And once we've verified they're a veteran, the services are there for them.
So it's an easy process.
It's very easy, yeah.
Good.
And if they don't have that document, we could even get it for them. We could order it for them.
Perfect. Good.
Okay.
Good to know. Okay.
Okay, so I'll just go down the line and talk about some of the things that we do. The RDR Copas Nursing Home is one of the newest facilities that was built here in Tradition. It opened in July, and it's a 120-bed facility for veterans. Currently, they have 2 wings open, a regular wing and a memory health wing. If you're a veteran who is at least 70% service connected to 100, the VA would pay for you to stay in that facility. If you don't have that kind of disability level, they also process you through Medicare and Medicaid. It's a beautiful facility. It's the latest state of the art. The next 2 facilities closest to us is Pembroke Pines and Daytona Beach. So.
And there's availability there, because I always thought that thing would fill up so fast because there's such a need.
Yeah, they have about 34 people right now on there.
Oh wow!
And they're always hiring staff. As you know, with the pandemic, it's been hard to get nurses and things like that. So they have need like that, but they have completed all their qualifications through ACA, and you go through a process of getting an application, submitting it to them, you qualify, and you go in. So if anybody has questions, they could come to my office and I'll direct them to the 2 people within the facility. But we have no control over them. There's a state run, but it's a wonderful place.
And so with that, I thought the same as you. The minute the doors open, it was going to be full on a waiting list. And there was a lot of people trying to get in, but they are having some criteria.
Yeah, they have to be at a 70% disability level.
And there was some other issues with some of the entries.
Okay.
I'm coming in with insurance and versus private pay, because they wanted to keep a few of the beds for private pay as well for somebody that wouldn't qualify. So Congressman Mass got involved, and after that because I think at that time there was 4 or 5, and then he got involved, and now they're up to 35, and I would say that probably within the next 90 days they'll probably be full.
Oh wow!
Because they've kind of got the system worked through.
Yeah.
And it is too that they're trying to not admit more than they have staffing for also. So as they get the residents in and they make sure that's staffed, then they line up the next 5 or 10 coming, they get the staff lined up before they bring them in, so that the quality of care is there.
You don't want to go from 30 to 120 in a very short amount of time, because your staff is not going to be up to par.
Right.
Okay.
Absolutely. So I also want to go over real quick some of the basic things we do, and then I'll explain them further. But if you're a veteran, if you're a dependent veteran, if you're a widow, there's a lot of things we offer. So we have service-connected compensation, and that's for the veteran who actually got injured while he was in service. We help them through the whole process. We help them with the claim and everything. For veterans that are low income, we have non-service connected pensions, and that just helps with additional money. We help them get into the VA system, the healthcare system within the VA. For veterans that have education, we get them enrolled in the education system so they could go to IRSC and some of our local education facilities.
And
here.
IRSC just developed a huge veteran center as well.
Yes. IRSC is very pro-veteran. The president's a veteran. He's phenomenal. We also educate people on burial benefits. A lot of folks don't know that as a honorably discharged veteran, you have a $12,000 plot and headstone at a national cemetery at no cost for you, your spouse, and if you ever had a child who was disabled and wasn't going to be able to take care of them, they will save the plot next to you. So when it's their turn to go to heaven, they get buried right next to you at no cost. And these are perpetual cemeteries that are maintained beautifully, and they're all across the nation.
Right.
Let's say that you ended up in Florida, but you were from New York or Hawaii. Well, guess what? You could get buried in those too. So you just have to request that. And all it takes is a DD-214, that document. And there's a lot of benefits for dependents. For instance, once a veteran passes, the widow inherits a lot of those benefits.
Right.
So it's incumbent on them to make sure they come and see us and we educate them on that.
Yeah, they're going to need help navigating the system. Obviously, we just heard about how it was hard to get into the COPAS Center. So there's always a little bit of bureaucratic red tape.
There is.
Absolutely. Now, the biggest thing that has happened is just recently, a new piece of legislation has come out, and the president signed it on August of 22, and it's called the PACT Act. Now, the PACT Act it enhanced the benefit package that veterans had for veterans and for their families. So I'm going to go over some of those things because most people are not aware of this. And if you have questions after you hear some of this stuff, please come to my offices. I have 2 offices. I have one in Fort Pierce, one in San Lucie. And we'd love to talk to you and educate you and help you apply for any benefits that you have coming.
Okay.
So the PACT Act is probably perhaps the largest benefit package that's been signed in a long time. And the full name is the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxins Act. And it's going to change the game, I say. The president signed it in August of 22 and is for veterans and survivors. Now, what does the PACT Act do? The PACT Act extends eligibility to VA health care. That's the first thing it does. The second thing, VA will improve the decision-making process. And what that means is the people that actually process the claims that come in, they're going to hire over 4,000 new claim processors to expedite the process and to help the veterans. They're going to, every enrolled veteran will receive a toxic exposure screening, okay? Toxic exposure related education for everybody. They're going to do research studies on mortality of veterans, why they died, where they were, and stuff like that. That helps for the future. The VA wants to build a stronger, more skilled workforce. And the biggest thing is the PACT Act is going to authorize 31 new VA facilities built. Okay, and those are going to be nationwide. So
retirement or hospital?
No, these are hospitals.
Very good.
Yeah. Now, the PACT Act has added some presumptives. A presumptive is a condition that, as a veteran, I might have gotten sick while I was, let's say I was a Vietnam veteran, I was exposed to Agent Orange.
Of course.
And I got a disease out of it. Well, I could apply for a disability because of that. But I have to prove that I was there, that I was exposed to the toxin, all those things. When the VA makes a presumptive, there's no fight. All we have to know is you were boots on the ground, you have the condition diagnosed, we put it in, and it's automatic. So they added all these new conditions, and I'm going to read through them because they're important for people to understand. But a lot of these are cancers, and when they say cancers of any type, that means it involves everything. Usually they're very specific. So brain cancer, gastrointestinal cancer of any type, glioblastoma, head cancer of any type, kidney cancer, lymphatic cancer of any type, lymphoma of any type, melanoma, neck cancer of any type, pancreatic cancer, reproductive cancer of any type, and that's male, female, and that's the entire reproductive system. And then respiratory breathing related cancer of any type, and that's where the toxic exposure comes from. Now, besides those presumptives, they also came up with a bunch of illnesses that come from the process which they call burn pits. What folks haven't realized that when we get deployed all over the world and in wars and everything, we got to get rid of our waste. And the way we do that is we burn it. Now, when you burn something, it exposes all the chemicals and everything within, and you're inhaling and everything. So we come back and we're sick. So now they've added all of these illnesses to that. So any veteran who has these illnesses could come and see us and could apply for a disability. And I'll go through those too. Asthma that was diagnosed after service. And that's important because usually to be service connected, it has to be a condition that actually was diagnosed within the time you serve or a year after. They're saying diagnosed after service. And these are conditions that usually show up in the body later on. So that's a big thing.
You don't get cancer the day they let you out. They don't, you know, these develop over time.
Exactly. Now, most of these are all respiratory issues, but chronic bronchitis, chronic obstructive pulmonary disease, COPD, chronic rhinitis, chronic sinusitis, constructive bronchiolitis or obliterated bronchiolitis, emphysema, granulomatous disease, intestinal lung disease, pleuritis, pulmonary fibrosis, and sarcoidosis.
So what you're saying is these are presumptive, which means they just have to prove that they served and they were deployed.
Right.
They no longer have to prove their exposure and the great lengths to which they can, you know, basically put them within a distance.
Exactly. If they were there and the doctor says they have it,
we're good. You don't have to prove beyond that, which is huge because I'm sure it must be very difficult to get that information out of the federal government of how many feet from a burn pile you may have been.
Yeah. Well, the thing when you burn something, it's just the plume goes everywhere.
Of course.
So, and when you're deployed in in a base, you're together, so everybody is exposed to it.
Yeah.
So,
Good.
The other big thing that has happened is for our Vietnam veterans there, with Agent Orange presumptive conditions, 2 big ones came out. The first one is high blood pressure, also called hypertension.
Mm-hmm.
The reality on that is that 47% of the national population has hypertension. So now you could apply for this. And then the second one was MGUS. MGUS is a very rare bone marrow disease. And I thought that I wasn't going to get any veterans come in my office. I've had 3 already with this condition.
Oh, wow.
And we applied for it. So it's important that if anything you've heard, any of these conditions, if you have them, come see us. Now, the PACT Act also extended the locations. It used to be that Vietnam, boots in the ground, was the only place that you would get that presumptive. So they've actually opened it a lot more. They added the U.S. Royal Thai military base in Thailand from 1962 to 1976. So there were exposures there too. Laos from December 65 to 69. Cambodia, Guam, or the American Samoa. And then the last one is the Johnson Atoll. This is an interesting one because this is a little island 500 miles off the coast of Hawaii, which the Secretary of Energy allowed to be used for us to detonate nuclear.
Did some testing on a
Did-
tiny
did-
little
little
atoll
island, yeah.
out in the middle of the ocean.
Yes, ma'am. And we buried a lot of bad stuff there. On top of that, after the Vietnam War, we took thousands of Agent Orange drums and buried them there. So that place became just an infected mess. And so anyone who was stationed there during that time, or any, for instance, sailor who was on a ship that went there, delivered stuff and came back and everything, could also apply for that. And that was through January 72 through 77.
Okay. I can tell Jose is very passionate about this.
He is.
Yes.
And he's done his homework. Did you put this together?
Yes, as a matter of fact,
Good job.
This is what my director, Diana Wolaski, and I briefed the commissioners on a while back when it first came out. Now, one of the biggest things that I want people to listen to is this. A lot of times we just think about the veteran, but there are also benefits that go to the spouse. Okay, because I say the veteran serves, well, guess what? The spouse is serving too, because when the veteran's out doing his thing, she's taking care of the home, the children, everything. And so we feel that spouses serve just as much as the veteran does. So for Vietnam veterans that were exposed to Agent Orange, and I'll share a hypothetical here. Let's say that we were married. I was a Vietnam veteran, and I died 10 years ago from something I was exposed from Agent Orange, okay? Because of the PACT Act, my widow could come into the Veteran Service Office and apply for a pension, and she'll get it.
Don't they get a pension anyway when their veteran passes?
Not necessarily.
No,
A-
okay.
a veteran-
It's dependent on certain.
Yeah, a veteran has to be service-connected and die from service-connected condition,
Okay.
okay? But the interesting is, usually when a couple, one dies, and let's say we were Social Security age, you get two checks. Social Security will give you the highest check, but one goes away. So
I know.
financially, you're kind of in a hole. And if you fall within these parameters, you could apply for DIC, and that brings you back to that level of financial stability that you need. So I am encouraging all widows of Vietnam veterans that if their veteran has passed and it was related to Agent Orange, all they need to do is bring their marriage certificate, their death certificate, come see us and we'll apply for this. The VA has received close to 269 claims just based on the PACT Act. So it's a big deal, and we want to make sure that we take care of our veterans. One of the other things that they have done is the VA has done a lot of toxic exposure screenings at all the VA hospitals. And I've actually partnered with the VA hospital to do one here at the Defense Center. So on May 6th, from 9 in the morning to 1 p.m., I'm having nurses and doctors come to the Defense Center, and we're going to open it to veterans to come in. I will educate them on the PACT Act, and then from there, it's going to be a one-stop shop. After they get the education, they're going to be able to sit with a nurse and answer some questions. And then once they answer questions from the nurse, they're going to walk in and see a doctor, and they're going to examine them. And then once they're done with the doctor, they're going to see some of my veteran service officers to put in a claim. And we can expedite this process
And
for them.
how outside what you just did now by this, how are you educating the community to know about that?
We educate the community in many ways. Our website has a lot of education. We do outreaches. We do, after COVID, we were kind of locked down that we couldn't go out. But we did this past month 17 outreaches. And what that means, I go out to facilities, veteran facilities, assisted living facilities, nursing homes that they have veterans. And I speak on this topic. And if we find veterans there, I get some of my VSOs there, and we make sure that we apply for these benefits.
And maybe Mike and them can put it up on the screen too.
Oh, for sure.
A little
May
bit of
6th. This is important.
So make sure that they have those dates so that they can put a
Absolutely.
little blurb at the bottom of the screen or something.
Absolutely, absolutely. And we pass all this to the communication director, Sarah Gill, so he passes it out on the PIO.
Okay.
Because, I mean, if you're a veteran, you should just come.
Well, and a lot of the
Yes.
families that are affected at this age group, their Social Security checks are not that large.
Right.
And so when one spouse dies, it really hurts because most of the people this age struggle to begin with on the 2 Social Security checks. And so this is kind of nice that at least when one does, is deceased, they're not going to lose a whole income. They'll get something back. So it'll be some assistance for them to be able to survive, because I know a lot of the people that age group really do struggle.
They do.
And it's worse whenever, especially the veteran passes. So
I heard about a dozen things that they probably may not know about and that they should be taking advantage of. So yeah, if you're a veteran, and maybe you don't think you need any of this today, but it'd be good to learn about it now and not have to wait till you do need one or several of these services. So May 6th at the Penn Center. What time does that start?
From 9 in the morning to 1 in the afternoon.
Love
Please
it.
come and get a screening. And if I may, I want to pass this on, because when I started doing this, I retired in 2014 and immediately started working as a veteran service officer. My first client was a Korean War veteran. And the only reason he came to see me was because he just got diagnosed with a cancer, terminal cancer. And we did all his paperwork and we applied it. At the time, it was taking 6 to 9 months for a claim to be adjudicated. Unfortunately, this veteran passed in 4 months. But the sad part about this story is that he could have been service connected 30 years ago. And our veterans are so hardcore and they're so proud that they think that the VA benefits is a handout, and it's not. Only 1% of the population serve. And this is a promise from President Lincoln to take care of those that have borne the wounds in battle and their dependents. Right. So please come, see us, let us educate you. We're all paid by the county. We do a phenomenal service. We don't charge anybody anything. Now, with that said, there are people out there that do that. And the only person that is allowed to charge a veteran for a claim is a lawyer at the appeals level. And that's when they're going to go see a judge, okay, way up there. But there are people out there that we call them pension poachers. And unfortunately, what they do is they tell the veteran, I'm going to do a claim for you and guarantee it. It's only going to cost you $2,000. And then they do 2 things. When the veteran leaves, they take the claim, throw it in the trash, and never goes anywhere. Or they falsify the claim, get that veteran some money, and then 2 years later, the VA will do an audit, and then they find out that he wasn't entitled to that. And now that veteran that's on a fixed income gets a letter from the VA that says, oh, you owe us $50,000. So they're doing a disservice to our veterans. And
if you're paying for veteran services, you need to rethink it, right?
Yes. If somebody asks you for money, please run away. Come see us. This is a benefit you've earned. Every county in the nation offers this service. And San Luis County is phenomenal. I mean, I can't thank you enough, Commissioner, and the commissioners, and the support that we get in this county to veterans. And they just need to come and see us. And we love to take care of our brothers and sisters.
So,
we are big on veterans here. And the one thing I will say is, you're correct. The men and women that serve, they don't want recognition. They don't want, they look at it like that was my job. I got up today just like a plumber did. I'm sure you have. I've done honor flight. Have you done honor flight?
Yes.
Yes. It's life-changing. It's a day of your life that is just so moving that you have no idea. And every veteran on that plane, when they're doing the mail call and they read the letters, they're like, what? This isn't about me. A lot of them can still walk, and they make them be pushed around in a wheelchair, and they're like, no, I'm walking.
Yeah.
There's nothing wrong with my legs.
Yeah.
But it's really a wonderful, wonderful
Tribute.
day and tribute to them. And you're correct. They don't want recognized to them. It was just their job, and that was the occupation they chose to serve. So again, thank you for your service.
Well, you're
Oh,
welcome.
definitely. And your new county administrator also is a
Yeah,
veteran
George.
too.
Yes, George is a veteran.
So what Jose alluded to is that many, when he says they're not connected, so they've never applied for their veteran benefits. They're,
Correct.
working here. Our clerk of courts is a veteran,
Yes.
so they probably have not applied. And by the time they need benefits from, the added benefit for their, not just for themselves, but for their family,
Right.
it's very far down the process.
There's
But you can
one
connect without utilizing it, right?
Absolutely. And there's one example I give everybody. 80% of veterans that are service connected is for bilateral hearing loss and tinnitus. Why? Because most of the jobs in the armed forces, you're exposed to massive acoustic trauma. Just being service connected for bilateral hearing loss, that means that when it gets to a point where you can't hear anymore, the VA will build custom hearing aids for you at no cost. Those things could cost about 10 grand.
They are very expensive. They're typically not covered by insurance very
Right.
They're
well.
not. My husband needs two.
My parents both have them
Yeah.
now, so
So those,
I
are,
get
those, are
that.
the, those are the little things, and people don't think about that.
Yeah.
So the message here is, no matter what phase you are as a veteran, you need to just go and get pre-qualified.
Absolutely. Come
Yes,
and see
just
a veteran
go
service
and
officer.
connect.
Yes.
Yeah.
And then that way, when you need the services, you'll be already in the system,
Mhm.
and you'll be
Absolutely.
ready to apply and not have to wait 6 months or a year, or however long it's going to take to get you certified.
And by then
Absolutely.
it's too late. So yeah, very great information, Jose.
Well,
Really.
thank you for having me. It's an honor.
Thank you for being
Thank you.
here. And
He has done a good job. When he came on, he hit the ground running, and he's never stopped. So you have been a true voice.
Well, thank you.
I know Wayne Teagarden, you know Wayne.
yes,
He did a wonderful job
his
back,
wife, Monica.
and he's still active and around. And,
Yes, he is.
but when Jose came, he picked the ball up and started rolling with it. He's done a good job. So thank you.
Well, thank
Very
you.
good.
And I know that Diana is here too. So with this, he is a part of that
Department.
department, and so they do stuff like rental assistance. They help sometimes with electric. If you can't afford something for your car, there's a program that they
There's
can
an
help
automotive
you,
program.
automotive
Yes.
program to help you with your car for the less fortunate. So anybody that has a need, I'm not saying that there's a lot of money in this department because it's a very slim budget in that department, and they really do vet you to make sure you really, really need it and your income meets the law. But reach out. People don't realize the services this county offers.
Well, I can say that I just found out about some of them. It's been a few years, but I have been around for a long time, and I wasn't even aware of them. And they participated in our Leadership Day, community services for the county, and we do that at Graceway Village. We have an expo, and I learned about automotive services, and I never knew they had that. I have referred so many people to that program. I'd love to have you guys, we're actually doing that next month, be a part in 2 months of our expo for leadership, because those people can help you get the word
Yes.
out. Yeah. It's
Yeah.
amazing.
There's a lot of services that's offered that you don't even think about. So I just always tell everybody, no matter what it is, pick up the phone and call the county and see if there's help,
Yeah.
because there's a lot of help here.
And I always recommend 211 because they typically have a good inventory of what is available to people in need in general. And so 211 is a great resource as well.
Our websites are excellent too. There's
Yeah.
a lot of information on our website. And just with tax season ending, community service even ran a vital service to help people fill taxes and everything. So
Yes.
those, at no cost. So like the commissioner said, there's a lot of great programs. They just need to reach out. They just need to come and talk to us.
There's help.
Yep.
You just have to ask. And I know sometimes, like especially the age that you work with, the majority of your age group, they don't have a computer. Some of them, they don't know how to work a computer. Some of them.
Absolutely.
So I know whenever I'm out and about and talking in HOAs or whatever, I say to them, then just pick up the phone and call my office or call your commissioner's office or
Right.
whatever, because we have the information. We have an aide.
Yeah.
And we'll get you the information you need, and we'll direct you to that department. So it can be frustrating sometimes to call switchboard and get pushed around and to this number in that department. So just pick up the phone and call your commissioner, and we can direct you where you need to be.
We get a lot of those calls too, because Chamber of Commerce is the same age group, so we get a lot of those calls.
Yep,
too.
we do. So thanks for being here.
Thank you.
Well, thank you for having me. Again, please don't hesitate. If you're a veteran or you're a widow, please come see us. You'd be surprised that you might have benefits that you're entitled to that you haven't applied for. And we will help you gain and get any benefit that's coming to you.
Very good.
Well, before we go, is there anything going on in the county that you feel that people should know about or be aware of, or?
We're getting ready to go into budget.
That's always the fun
That's
time.
always the fun part. We're lining things up for that. Our airport, I think it's not new news anymore, but
Yeah.
we're open for business. If you want to have something, come talk to us. Things are moving there, and it's going to be private. We decided to not go out with the FBO. We have a new port director, Josh Revord, who has always been our engineer with the beach. He's currently doing the inlet dredge.
Yep.
He has been moved over. He is now the port director over at the port. So we'll be seeing some activity, I think, moving a little bit further towards Harbor Point. We just had our tri-county meeting to start up our essential housing,
Yes.
which used to be affordable housing, but it's not Section 8. It's the workforce essential housing.
Essential housing is what it was. Affordable, then it was attainable, and now it's essential.
Well, I think because the reason why though is the affordable housing, people
Thought
kind
it
of think
was
it's
Section
Section
8, yeah.
And so it's being labeled as essential housing. And Okeechobee, St. Lucie, Martin, and us have met. We have a team together, and we're going to start looking at some things to put in place to make it affordable for development to come and build the essential housing. Georgia's hit the ground running. We're out looking for the second person to join Maite, which we met at our last thing.
Yes.
She's going to have a little bit of help and relief.
Good.
And, the county's doing very well. We're in a good place.
Good things are happening.
Yep. So I just want to say, again, thank you for being here and thank you for your service. And thank you to all the veterans that are out there that have served. Thank you for doing that. And I know we had some new guests today join us for the show. So it's always nice to see a new face. Does anybody out there have any questions y'all want to ask?
Oh, good.
Hi, thank you. I'm curious to some of the veteran services that are available. Do any of the services provide to the veteran help for their parent? I know we talked about spouses and dependents as children, but what about the veteran themselves, their parent? If their parent, mom or dad, are in need and they're struggling to make ends meet already, and they have to care for their mom or dad.
There are some programs available, so I have people come see us.
Okay.
Because on occasion, if I was serving and I passed during service and I didn't have a spouse, my parents would have been taken care of. So there are programs in place to help them as well.
Very good, thank you.
You're welcome.
Good question.
Any other questions from our audience today?
Everybody's being quiet.
Good. Oh, Kenny's got one of our ambassadors.
If there's a small business who's interested in serving veterans and maybe teaming up with the veteran department, how do you go about getting I don't know what it's called, a contract or something like that, to be able to work with and serve our veterans?
That's a good question for this audience. So that's a private-public partnership. So that gets a little murky, right? So what you can do is offer something within your own business, a benefit, a discount, free programming, and perhaps we can even help get that out to the public. But when it comes to a private-public partnership with his department, it gets a little tough, right? That's got to be vetted by legal, and trust me, it's like working with the FDOT. You don't want to go down that road. Don't tell legal I said that.
I heard nothing. And that's what a lot of the companies do. They'll say that if you're a vet, you get a 10% discount, or we'll give you, some restaurants of like, you'll get a free dessert. Some of the coffee places, if you're a veteran, like they do with the police, free cup of coffee. That's how they do stuff like that.
Kenny owns Visiting Angels.
Okay.
Yeah. So he probably has many services that they would benefit from. So that's something that we probably need to think about. Make sure you're offering something to your veterans.
We do a lot of referrals to a lot of the nonprofits out in town. And all we ask in return is when a veteran comes or widow and they have no idea about benefits, please send them our way. We just reciprocate that way. If there are services that we don't have available, we go out in town. And with community service too, they have a wonderful list of services. So we help each other to help this individual get through whatever issue they're dealing with.
But I can say what you do want to do is make sure they know about whatever it is you're offering. Very good.
But that is a good conversation, and maybe that's something moving forward legislatively, something could maybe develop at that, because there are a lot of home health companies that go in and offer services for the elderly that maybe eventually it could be a connection there, because the VA can't always staff everything, and as time goes on, more and more veterans are going to need services. So rather than building more and more of these homes, to partner up with the agencies that provide their services. And if you're a veteran, then they would be able to bill the VA, and the VA would pay for some of those services.
Think there are some visiting home health care benefits, so some of it is billed directly to the VA.
Right.
Yes, they're actually the VA Medical Center in West Palm Beach has a way of processing. If you wanted to provide your services to a veteran, you could go and talk to them, and they'll link you in, and then you become a refer member, and they refer people directly to your business. So, yes, but that's one way to get into the. Okay, so you're learning.
We alluded to the bureaucratic red tape of many things.
Government is very difficult.
Yes, and the higher up you go, and this is the federal level, right? The higher up you go, the worse it gets.
I mean, there's things here at a county level that we can do, and we can kind of make happen quick, and we can create change because of home rule. But once you go beyond us, it becomes challenging, and the higher you go, the more challenging it is.
For sure. But good stuff.
I applaud you for trying to help veterans, so thank you for trying to do that. We need more of that.
Department of Defense teachers, and so we're familiar with military-connected families.
Okay.
And so it's been a joy to get to know the military-connected families the past decade, and so we're passionate about helping them, and I appreciate what you do for the military.
So when you get a chance, come and talk to me in my office, and we could discuss what you're doing, and I will know about you and what services you provide.
Absolutely.
So if somebody comes in and needs that, and I don't have it, I will pass that information on.
Thank you. Appreciate it.
You're welcome.
Well, great show today. Great show. And the May 6th event, I want to make sure that everybody knows, if you're a veteran, just go. If you don't think you're going for yourself, go to support your other veterans that are going, right? Just
Absolutely.
Make it a day of veterans. May 6th at the Ben Center, 9 to 1,
9 to 1 is Saturday, yes.
And they'll put it up there.
Yes.
They'll put a little thing at the bottom of the screen of this show.
Okay, fantastic.
It'll be up there.
Thank you, Commissioner. I appreciate
Absolutely.
it. Thank you so much for
Thank
having
you.
me.
I always want topics that people want to learn about, and I always try to utilize this as a way to educate the community. So there was a couple, I guess a month or two back, that there was a lot of things that had come out in a meeting, and people just didn't realize all the stuff that we did. So that's when I was like, okay, well, Diana's services, and you need to be on the show to let people know, because believe it or not, people do watch this crazy show.
They do, and we're so honored to be a part of it, to be honest with you. The Chamber of Commerce, we're our own nonprofit outside of the county, because everybody always thinks that. They either think I work at the county or the city or for the Mets, because those are the shows that I do. But we're just so honored to be able to bring information like this to the community. So thank you.
And people share it, they pick it up and they share it. So it's a way to get information out there.
Absolutely. Thank you.
And we can only do it. Thank you to A&G Pools. Again, of course, your good friend Sandy Allen, and Travis Leonard, a good friend of mine, and Mike. Mike comes, he brings his coffee, which he brings different coffees every month, right? It's not like a box
So
of
if
Joe.
you don't come to this show, you're really missing out on the best cup of coffee in town. I will tell you, I have 1 cup of coffee a day, sometimes half of that. And I'm not saying this because he's sitting here. I have to have lots of French vanilla and stuff in my coffee because I'm not a true coffee drinker. But you have the best cup of coffee I've had.
Yeah,
in
he
St.
brings
Lucie
us different
County.
stuff. Today is an
I don't know what
Ethiopian-
coffee you use, but it's good coffee.
He uses different ones. Today is an Ethiopian blend. He brings us different coffees.
It is nice. It is a nice cup of coffee every time I've come. And hey, he's been here.
He puts
It's
up a
always
great
been
spread.
a great cup of coffee.
Yep. But he has a shop on US 1 in Port St. Lucie. It is called Steamworks. And he always sits through the show, too. He doesn't just drop it off and run. He stays with us. So we appreciate Mike. Here's to Mike today.
Mike and Mike, because we also have our computer
Mike
guru.
King.
Like I walked in here, my flashlight was on my phone, and I'm like, how do you turn it off? And Mike's like, Kathy.
So actually we have Mike, and Mike, because
Yes.
our
We have
our
our wonderful
cameraman.
Mike and the cameraman. Can you zoom in on Mike over there and let him say hi? Because
I
he
don't-
never gets recognized.
I don't know what studio she thinks we're in.
Come on,
Like,
studio.
just
Go to
saying.
Mike.
There you go. Mike's going to have to get Just zoom in on. I'm
Just
like, where are
zoom
we
in on
at?
Mike.
The Super Bowl? We don't have
Yeah,
that kind
come
of.
on. Mike never gets recognized for anything.
Yeah.
How long have you been with the county, Mike?
14 years.
And
Okay.
and he's always in the background, and nobody ever knows who he is, and he's a hard worker. I keep trying to get him on the show. He won't come on the show with me.
I know he doesn't like to do
No,
it.
he doesn't.
Eric will do it.
And he's got a story to tell. He's a stroke survivor, so he could really tell his story, and that's something to talk about. So, anyways, thanks for being here. Nice meeting our new girls that joined us today. Thank you for being
And
here.
thanks to Nash from my office that always makes sure we have the call. She's in charge of calling Mike and Mike and Mike and every other Mike.
Yeah.
So all the mics is Nash's purview. So
Okay, and
thanks
you
to
got
her as
moved
well.
to your new office.
Yep.
So that's just
Across the
another
street.
another plus that you're closer to us, and county's doing well. So again, thanks everybody. Thank you, veterans, for your service.
Thank you.
I guess when this air shows, it will be
May.
Mother's Day. Happy Mother's Day to all the fabulous moms
Yes,
out
happy
there.
Mother's Day.
And again, always a fun morning.
Have a great day, everybody.
Thank
Bye
you.
bye.